Okay, so in this lecture, I'm going to be talking about behavioral self-control training. This approach has had a kind of a storied history and at one point was considered to be actually very controversial. And so this really started back in the 1970s when Mark and Linda Sobel published a study with gamma alcoholics. We don't really use that classification anymore, but gamma alcoholics were the ones that had out of control drinking and tissue tolerance is how they were described. Um, and they talked about the potential problem of a controlled drinking paradigm or teaching alcoholics how to drink in moderation. And essentially, they said that the group that received this moderation management training actually had better outcomes than people who received a more abstinence-oriented approach. Well, these claims were challenged by another researcher who suggested that these patients never drank in a controlled manner. And the charges, so eventually charges were brought against. Okay, so in this lecture, I'm going to be talking about behavioral self-control training, also known as BSCT. This has had kind of a storied and controversial history. It originally gained some traction or attention at least back in the 1970s when Mark and Linda Sobel published a study with gamma alcoholics. So these were folks with tissue tolerance and out of control drinking. We don't really use that classification anymore. And they talked about the potential promise of a controlled drinking paradigm with this population of alcoholics, basically stating that in fact, a controlled drinking approach produced better outcomes in terms of problematic drinking days than an abstinence-oriented approach. Another researcher challenged these claims, stating that a follow-up with the participants in this study actually showed that none of them had ever been able to drink in a controlled manner. And then ultimately, the Sobels were actually charged with producing fraudulent data. Well, of course, this then triggered an independent scientific review, and the Sobels were ultimately exonerated of any wrongdoing, but the damage had been done, and controlled drinking or moderation goals research was really cobbled for a long time. But as you'll see, recent research, so like in the last, say, 20 years, has led to some increased interest again in this approach, and it may be in part due to motivational interviewing perspective, which is that it's best to tailor treatment to clients' goals to the extent possible, and that for some clients, abstinence may not be an acceptable goal. So again, thinking about it from an MI perspective, clients who are not ready to attempt abstinence, either because they just don't think that it's reasonable for them or they don't perceive themselves to have a problem, BSCT may be a reasonable intermediary step. Clients who are exposed to BSCT and then are able to drink in a controlled manner, that may be sufficient. Whereas for others, it may sort of be an opportunity to explore whether this is a reasonable option for them, and for those for whom it's not a reasonable option, this can then allow for a conversation about perhaps they may need to reconsider their goals. So again, meeting the client where they are, taking a stepped approach, acknowledging and respecting their autonomy to make decisions for themselves, but then ultimately using their success or lack of success with this approach as a stepping off point towards perhaps um, a more rigorous goal of abstinence. So this might also be useful for people who are using or drinking at problematic levels, but not pathological levels. And it's an idea that might be used with college students who have alcohol violations, recognizing that these folks may not have alcohol use disorders, but are drinking at dangerous levels, and learning strategies to be able to effectively manage the amount they drink to reduce risk would be a reasonable approach in that case. All right, so this is an approach that capitalizes on ideas of both self-efficacy and self-control, right? So it requires the belief in one's ability to control one's drinking. So if a patient states that they believe that the only effective strategy for them will be abstinence, then behavioral self-control training should not be considered in that case. So there are 7 different steps, not really steps, but strategies that are used in behavioral self-control training. The first involves self-monitoring of drinking and urges to drink. So when you're thinking about behavioral interventions, we often need to start with some kind of baseline. So we want to know from the beginning, what is the client's baseline level of drinking? How much are they currently drinking now before any intervention is implemented? That's so that we can set some reasonable goals for the client, right? So it's not reasonable to say, if you're drinking 15 drinks, maybe it is, maybe it isn't, but clients may be unwilling to cut their drinking in half. So it might be reasonable to say, well, if you're drinking 15 drinks an occasion, let's cut it down by a third to 10 drinks. Let's try that for a while, and then maybe we can cut it down to half, down to 5 drinks. And so it can be a good jumping off point to make some decisions about what specific goals should be set, right? So goal setting is the next, and that's the idea of setting limits on the number of drinks the client will consume in a given setting. And again, this is something that should be negotiated between the client and the therapist, keeping in mind some NIAAA guidelines about binge drinking, and this would be considered really dangerous levels of drinking. For men, that's 5 or more drinks in a sitting, and for women, that's 4 or more drinks. So these are considered heavy levels of drinking and potentially dangerous. So ultimately, this would need to be negotiated. Think about what would be reasonable for the client, and what goal are they willing to accept. And then that would become sort of the baseline of where they're trying to ultimately move to. In order to achieve those goals that they've set in terms of the number of drinks they'll have in a given drinking occasion, the first strategy would be to change the rate of drinking. And this can be done in a number of different ways. If the client is willing to be honest and let people know that they're trying to reduce the amount that they're drinking, they might be able to set a timer. So, maybe an hour. So say that I can have 1 drink per hour, and they can only have that drink, and they can't order another one until the timer goes off. So that's one method. And that would work only if the client is willing to be honest about what they're trying to do. Another one might be to drink non-alcoholic beverages like water in between drinks containing alcohol, so that will help to slow the rate of drinking down. And a third option would be to drink something that looks like an alcoholic beverage so that it doesn't draw attention of people that the individual's drinking with. So perhaps getting orange juice looks like a screwdriver, or getting cola that would look like rum and Coke, something that would not cause others to pay attention to what the individual is drinking, or asking for water in a highball glass, something that looks like the person is actually having an alcoholic drink, to sort of direct attention away from what they're doing. So again, the idea being that changing the rate of drinking can certainly significantly reduce the number of drinks consumed in a given setting. Another would be practicing assertiveness and refusing drinking. This is going to be particularly critical if the individual's out with other heavy drinkers who want to normalize their own level of drinking by encouraging the client to drink as much as they do. And again, I think this is going to be really powerful, but a lot of it depends on clients' motivation to use that skill, as we talked about in the skills training module. The next would be to use behavioral contracting and contingency management. So behavioral contracting is essentially doing a goal setting within a written format, where the client and the therapist agree to a certain amount, or even the contract could be between the client and a supportive family member, where they agree to this certain goal of X number of drinks in a given setting. And then there's a contingency management intervention that's set up. So the client is either getting some kind of reward for sticking to the goals, or they're getting some sort of punishment for failing to adhere to those goals. It's important to remember that reducing the amount of their amount they're consuming in a given drinking occasion isn't inherently rewarding, right? In fact, it's probably not rewarding to the client. They're not getting the level of intoxication that they want, and they're potentially getting harassed by their drinking buddies. And so it's important that we figure out a way to make that change in behavior as rewarding as possible. And if it requires the um, delivery of external incentives until the behavior becomes a habit, that may be important. And so involving a significant other who can provide those rewards may in fact be a really useful additional strategy to make this a more effective approach. We've talked about functional analysis before. So functional analysis of drinking behavior, goal here would be to identify triggers for high-risk drinking and learning ways to avoid or cope with those triggers, right? So this is what skills training is all about. If we know that, for example, the person is more likely to drink heavily after a long and stressful day, then teaching the client some stress management skills might be the way to handle the situation. Or if they're more likely to drink heavily when they've had a conflict with a spouse, then perhaps teaching them methods to manage negative thinking, right? But the idea being that having effective strategies to cope with those triggers will be a real key to successful moderation. And then finally, relapse prevention would involve teaching the client skills for coping with unexpected challenges or high-risk situations that are unanticipated. And I think I've mentioned this in the skills training module before, that while it is easy to plan for and prepare with skills to deal with situations that are anticipated, those that are known to be triggers, it's a lot more difficult when the person is surprised by a trigger. And so having an emergency plan in place for how to deal with those unanticipated cravings is going to be also critical to prevent relapse. And part of that plan may also involve reaching out to the counselor for a booster session to kind of debrief any difficulties that the client may have had. A strategy that I kind of like and can be really helpful to clients is coping cards. So I've used this quite a bit, can be used for a lot of things. Coping cards are usually 3x5 index cards, but they can be smaller, something that can fit in a purse or a wallet. And essentially the example that I've here is on the one side, the client might write reasons for moderation, and then they need to list those things that are particularly important to them for motivating them to reduce their drinking. And then on the other side, coping strategies. So anything, so these are sort of the typical things that I've had clients write on there. It can also include phone numbers for people they can call, although frankly with cell phones that's not necessary anymore. But anything that will help the client remember why they are pursuing this goal can be useful additions to the coping cards. And the client is basically told that during when they're experiencing an urge to drink heavily or they feel like they're at risk of over drinking, they can pull the card out during a delay, right? So we talked about delay at some point in the semester. So, delay the decision to drink for 15 minutes, pull out your coping card as one strategy that you can use during that delay period to remind yourself why you're doing what you're doing. It could also include your cost-benefit analysis. Again, thinking about other things that might be useful for the client on that coping card. All right, so I'm going to end this one here, and then there'll be one more lecture that's going to talk a little bit about contingent social reinforcement, since your textbook really only alludes to that. And I think it's really sort of important for you to get a handle on other types of incentives that can be used to meaningfully help clients either achieve abstinence or achieve moderation.